Martin Reed is here today with me. I'm going to let Martin talk about his story and how he came to understand a little bit more about what people need to know about having any type of orthopedic and rehabilitative surgery.
First came to Bert for strength training and to focus on my bicycle riding, to do some competitive bicycle riding, and needed to have surgery on my shoulder. Prior to coming to Bert, it was a pre-existing condition where I had torn my labrum snowboarding, and hired Bert on as a medical consultant to help me with choosing a surgeon and then the whole process of getting the surgery done and then rehabbing it as well. And before we went to the doctor the first time, Bert had mentioned that, all right, this is what the medical industry is all about. They only care about money. It's going to be difficult. And I brushed it off at first as, well, you know, maybe that's your experience. We'll see how it goes. Really, it couldn't have been worse. From the first time we went, they tried to get me to get an MRI, which would cost about $2,000. And when it really came down to it, we asked the doctor if it was absolutely necessary, and he kind of lowered his voice and leaned in a little bit and said, it's the standard, it's what we normally do, but you don't really need it. So that was just sort of a microcosm of how everything was going to go. I finally got the surgery. Afterwards, the nurse who was discharging me didn't even know what procedure I had gotten done. I had to tell her what I had just had done so she could sort of tell me what I needed to do over the next few days. The day after the surgery, I received a call from a nurse at Tucson Orthopedic Institute, returning my call from a month earlier. I had left a message regarding a question about the surgery, and she had just gotten around to returning it. So just a few things that I can recall off the top of my head that were very typical of the whole ordeal. Luckily, I've had Bert, who's been helping me rehab it and getting it back on track.
I had experience way back in the day, over 25 years ago. I worked with athletes such as Terry Francona and helped him with 2 knee rehabilitations. Tom Waddell, who was second to Willie Hernandez in the Cy Young back in the day, and many other athletes. One of the things I noticed right away that their performance never did seem to come back the way it was, and the surgeries that were done for them weren't always done, as I would say, with their performance really in mind, but more or less to get the problem fixed and let them deal with it themselves. The medical industry today, for the most part, I'm not going to throw every doctor out there under the bus because not every doctor is like this, only most of them. They tend to seem that, you know, they want to move you through. We went to the first appointment with Martin and I told him this would happen. We walked up and the first thing we run into was an obese nurse that probably weighed over 350 pounds and had the attitude of, why are you here and what are you looking for and where's your insurance card, and I need to scan that first. I said, Martin, isn't it nice she cares that we're here today? And I asked her, I said, we're here for a 1 o'clock appointment. She said, well, our doctors run at least 20 minutes late. I said, well, they can run 20 minutes late all they want to, but we're not allowed to, so I don't expect him to, and my fee is a little over $200 per hour for every minute we're late. So if you'll please let the doctor know that we're going to deduct that from the bill, that would help us. She right away wanted to know who I was. I said, I'm Martin Reed's medically paid, and I'm paid. I'm his medical advisor and his medical advocate. I said, if you can't get this job done here at Tucson Orthopedic Institute, we can find someone else. She immediately gave us an attitude, sent us over to another office. That's when the doctor started to tell Martin that he needed to have a scope. And I said, doctor, how many of these operations have you done? He said, well, I do about 300 a year, and I've been doing it about 15 years. I said, so in your experience, how many times when you go in there do you see exactly what the MRI or the scope showed? He said, not much. He said, we usually have to still check it out. I said, then is it really necessary? You can tell by the way this man's working his arm and what's going on. He said, well, he said, you're right, we really don't need to. I said, you know, it's running his insurance bill up and everyone else's in America. And so Martin was getting quite the eyeful, and at this time he started laughing and he goes, I can't believe you said this. I said, just be glad that we've got over 8 weeks of training before you've gone to this to have the musculature in your body at a point where you'll be able to rehab it in record time. As he said, when he left the hospital, he had been given an answer to questions he'd had prior to surgery by 3 weeks, several days after the surgery. This was typical. When we called the doctor prior to his surgery to let him know that questions were not being answered, he tried to tell us that he was going to talk to his staff, and let me tell you that that staff acted like they were protecting God. And they aren't protecting God. They're not God. They're much lesser than God, and the nurses who work for them are even lesser. They were all obese. Many of them, you could tell, were smokers. Most of them cared about as much as health as your dog would care about living in a piano case. One of the things that Martin got to see when he walked out that they didn't know what procedure it had, he had to come straight to my facility to ask me what do I do and how do I do it. At that time, I gave Martin things that were natural to keep him off the pain medications. Within 48 hours, he was off of all meds, all pain medications, and we used some very, very light vibrational electrical treatments for the musculature in the arms and to increase circulation, reduce swelling. We gave him supplementations, herbs. Martin felt much better within days. We went to the doctor the other day and we asked him what we needed to know then, and we received about less than 3.5 to 4 minutes worth of consultation for another $50, okay, which didn't need to be done, which could have been discussed over the phone because there was nothing shown that didn't need to be remedied on the phone. So the big thing that we're here today to talk about is Martin was a very skeptical individual, and he's seen this now, and he's seen other individuals who we've worked with. So the lesson here is to don't listen to the intimidation, the lies, and the extortion. You know, use some common sense. Go out there and find people who do the rehab, and don't hire a physical therapist who does not know about how to use the resting heart rate in the morning or to advise you on supplements and things that you need to put back into the body. Surgery was a stress, get that, and that all that you go through under surgery is a stress, and it eats up all the reserves of the body, and you need to replenish those specifically and exactly and in adequate amounts so that your rehab time will be less than it has to be according to the doctors. So especially if you're athletes like the ones that I work with, or Martin, or young children, make sure that you've got the prior proper preparation as the Marine Corps used to teach us. So this is what you need to know about surgery and rehabilitative surgery.